بسم الله والصلاة والسلام على سيدي رسول الله. السلام عليكم ورحمة الله وبركاته، وأهلا وسهلا بكم، وتحية لكم من محدثكم الأستاذ الدكتور طاهر تونسي. I am Professor Tahir Toonisi. I will speak today about whooping cough in children or pertussis in children. Whooping cough is caused by Bordetella pertussis, a gram-negative bacillus. It is characterized by prolonged spasmodic cough terminating in a whoop and accompanied by vomiting. Incubation period is 7 to 14 days. Clinical picture. First of all, the catarrhal stage. One is catarrhal stage. The patient has anorexia, nasal discharge, and sneezing. Second stage is paroxysmal stage. The patient has paroxysmal cough, which is accompanied by cyanosis and ends in a whoop or vomiting. Subconjunctival hemorrhages are common. The cough is usually much worse at night. The lungs may be remarkably clear on auscultation unless bronchopneumonia supervenes. The third stage is the convalescent stage. After 4 weeks of paroxysmal stage, the convalescent stage begins. The appetite improves and the paroxysmal cough gets less. Investigations: leukocytosis occurs, ESR is low, the organism can be isolated from the nasopharynx using Bordet-Gingo medium. The treatment of whooping cough: a 14-day course of oral erythromycin is the antimicrobial therapy of choice for patients with pertussis or whooping cough and for close contacts. Typical dosing schedule is 40 to 50 mg per kilogram per day, not to exceed 2 grams per day in 4 divided doses. Some experts prefer the isolate preparation in young infants because of more effective absorption, which may lead to decreased dosing and less frequent dosing intervals. The complications of whooping cough are otitis media, bronchopneumonia, atelectasis, emphysema, bronchiectasis, cerebral hemorrhages, and convulsion. Prevention: DPT and polio is given in 3 doses beginning at the 2nd month. Encephalitis is a rare complication of the pertussis vaccine. And thank you.